eyes. Tonight,
They saw one little area, so they started to watch it closer and closer.
an ABC 27 special presentation.
As lung cancer patients, they want the doctors to not only care for them, but care about them.
Lung Cancer, a Matter of Facts, sponsored by Penn State Cancer Institute.
Good evening, I'm Deborah Pinkerton. Anyone can get lung cancer. Lung cancer occurs when cells in the lung mutate or change. Lung cancer is common. In fact, lung cancer causes the most cancer deaths worldwide, accounting for 2.1 million newly diagnosed cases each year. Smoking is the greatest risk factor for lung cancer, but there are others like exposure to radon gas and pollution. Why is early detection important, and what treatment options are available? What can you do to help keep our cancer patients safe during a global pandemic? We will answer those questions tonight. And at the end of the show, we're going to answer some commonly asked questions. Denise McCracken is here to fill us in. Hi, Denise.
Hi, Deborah. Yes, cancer patients have a lot of questions. They want to know how to handle the pandemic and the holidays. Should they go home to visit family? We'll answer those questions later in the show. Deborah.
Thanks, Denise. A Centre County woman never expected to hear the words cancer. Becky Blunt has learned how to battle this diagnosis. Here's Becky's journey. Becky and Dan Blunt are retired. They have some much needed time now, and it's time focused on Becky's health. Becky shares her journey that began 12 years ago.
Well, I was having severe back pain, and my mother had a heart attack, and hers started with severe back pain. So I decided I would get it checked out, and when I did, it wasn't my heart, but it did turn out to be a neoplasm in my lung, which was completely devastating to me.
And it's just like your whole world dissolves. You just can't believe in just a second that everything goes from being fairly normal and very, I can handle this, to, oh my God, what have we gotten ourselves into?
And of course, you immediately think, when you hear cancer or think cancer, it's a death sentence, that's it, But I had early detection, so that was the one thing in my favor at that time.
Surgeons removed the right upper lobe of Becky's lung.
The doctor said we got it all, and everything was going back to normal, and we thought, hey, we can go ahead with our plans.
For 12 years, doctors monitored Becky.
At least every 6 months, I would have either a CT scan or a PET scan. And they would watch to make sure that there was no highlighting areas or that there was nothing new there.
The scans looked good until earlier this year.
They saw one little area, so they started to watch it closer and closer.
Then they said, well, there's one that's had some growth, and it looks different.
And at that time, when he said that they were going to do a biopsy, I decided that I would reach out to the Hershey doctors.
She underwent sort of bronchoscopic biopsy, which determined the soft tissue growth to be lung adenocarcinoma.
He was very uplifting to me that it's not going to be a problem to take care of.
Dr. Ma recommended chemotherapy and radiation.
So essentially it's a combination chemotherapy as well as at the same time daily radiation up to the dose regimen intensity to allow curative intent of treatment to eradicate the lung cancer that has been identified.
What's the best thing of all is that we came up between radiology, oncology, and pulmonary oncology, a game plan.
And I was under radiation every day for 5 days a week and chemotherapy once a week.
Becky recently finished that treatment, and it was successful.
It showed some tumor shrinkage with no other new disease evidence as well.
We're ecstatic. The fact that the radiation did show that it did shrink the tumor.
Now Becky moves on to the next phase of treatment.
They determined they wanted to do some immune therapy on me. It's a new treatment. It's just been recently FDA approved, I found out.
The principles of cancer immunotherapy is based on summoning or sort of awakening patients' own immune system to fight the cancer.
With the guidance from Dr. Ma, it's a battle that Becky and Dan are ready to fight again.
So we're in the journey together. You know, I always try to earn their trust to see me as their coach, the good coach. They're the one who's in the race. You know, I try to offer them hope.
Hope is the biggest thing we have again now. Because we're seeing it work, I have hope for years with her, not just months.
I'm ready to start a new chapter. I'm ready to start the immune therapy, and I'm ready to get back into doing what normal retired people do, which is travel. I want to travel.
She is a miracle. They found her cancers both early and treatable. She's my miracle, but I still push her because I want her to be with me forever.
So very sweet. Becky will be on this treatment plan for a year, and Dan will be there to help her every step of the way. Now joining us is Dr. Patrick Ma, oncologist and Associate Director of Translational Research at Penn State Cancer Institute, and also Becky's doctor. Thank you for being with us.
Thank you.
Talk to us about the signs and symptoms of lung cancer.
Yeah, it's a very important question relating to lung cancer. We need to understand that signs and symptoms of lung cancer relates to the site of the disease, and obviously also relates to the stage of the lung cancer disease. Unfortunately, most of the symptoms, and sometimes it may not come with any symptoms at all, but most of the symptoms relates to the respiratory symptoms, system in the early stage, common symptoms, and non-specific. So it's important to have awareness of the risk factors and knowing that not only smokers can get lung cancer, but also non-smokers and young patients can also get lung cancer. So with that as a background, symptoms such as cough, particularly coughing of blood, cough that don't go away, even with antibiotics, shortness of breath, particularly new ones associating with wheezing or pain in the chest or other area of the body, hoarseness of the voice, pain during swallowing, difficulty swallowing. All those are actually concerning symptoms. When it comes to, profound fatigue or weight loss, it may actually be somewhat late already, and that's important to be aware of. So all it comes down to awareness. If you have bronchitis, pneumonia being treated by your primary care, if it just doesn't get better, even if it's just a cough that lasts, I think it needs to follow up closely, with more imaging and medical follow-up or specialist referral.
Now we know that Becky did not have surgery this time around, but is surgery sometimes an option?
Yeah, in general, lung cancer surgery relating to bystander curative treatment modality, lobectomy or pneumonectomy are generally reserved for earlier stage curative lung cancer, particularly non-small cell lung cancer, for stage 1 and 2, and highly selective locally advanced stage 3 non-small cell lung cancer. Becky obviously had her initial surgery for her stage 1A non-small cell lung adenocarcinoma 12 years ago in 2008. Surgery was actually entertained initially within our multidisciplinary thoracic oncology lung cancer group, but weighing between the pneumonectomy with a high demand and risk for her case, overall the decision ultimately was made to treat her curatively but non-surgically with combined chemoradiation followed by hopefully immunotherapy, which is actually what she's getting right now. She's been doing quite well.
Yeah, that's what I was going to say. Becky is doing very well. Now, as we saw in her story, though, she said that getting this cancer diagnosis, it's devastating. But patients now are living longer with the treatment options.
And it's great news. As I entered, medical oncology training almost a decade and a half ago, this is our dream, especially when we're getting into lung cancer care. We do have data supporting that claim. Starting from 1990, overall lung cancer death in men has already started to show signs of decline and an ongoing trend as well. Lagging behind a little bit, 10 years later, by year 2000, female lung cancer death actually continued to decline and continue so. And I think first and foremost, the most important reason behind that decline in lung cancer death rate is public awareness of risk factors from cigarette smoking, tobacco industry. So there's a smoking cessation public policy movement going on, and more people stop smoking and less people pick up smoking habit in men and women. But more importantly, in more recent years, we have actually better therapeutics for lung cancer involving not just chemotherapy, radiation, but also targeted therapy or personalized therapeutics. Beyond that, we have better diagnostics as well. Nowadays, we have to treat the lung cancer as not one disease, but a multitude of different molecular or genomic disease using molecular genomic profiling, as well as more recently, we have FDA approval for liquid or blood biopsy to achieve tumor molecular profiling. All those enhance our cancer therapeutics efficacy. But more importantly, we need to bring awareness to the public regarding the importance of high-risk patients, especially smokers, to undergo CT scan, low-dose CT scan of the chest screening program. And last and not the least, immunotherapy advance in lung cancer use plays a big
Lots of
role.
really good information, Dr. Ma. I know we could talk about this for a very long time, but certainly very good news, and we appreciate all the information that you have given us tonight.
Thank you.
And if you would like to make an appointment with the Penn State Cancer Institute, call 866-259-3713 or visit online at cancer.psu.edu. Coming up next, we will hear from a Dauphin County woman who was diagnosed with lung cancer at 85. Doctors have been treating her for the past year. Find out how she's doing. That is coming right up. Stay with us. We will be right back.
This is Krista's happy place. This is Krista's warmth. This is Krista's heart and soul. This is Krista being a mom after cancer. This is Penn State Cancer Institute.
You're watching Lung Cancer, A Matter of Facts on ABC 27, sponsored by Penn State Cancer Institute.
Welcome back. 1 in 16 people in the United States will be diagnosed with lung cancer during their lifetime. A Dauphin County woman is part of that statistic. Joining us is Joan Arnold. Joan, thank you for being with us.
You're welcome.
Joan, what was your situation?
I had some symptoms which concerned me, so I contacted my family physician. She set up a couple of tests, and the CAT scan showed a spot on my lung. Interestingly enough, the symptoms that I went to her for had absolutely nothing to do with the lung cancer. It was just sort of a fortuitous discovery.
Wow, so an incidental finding. So what was your reaction?
Well, I was not going to have chemo. I was 85 at the time, and I just didn't think that my body would withstand traditional chemo. A friend recommended Penn State and Dr. Hull specifically, and I contacted him, and we went through the various options, and Dr. Hull suggested Keytruda, which is an immunology treatment. And I had a biopsy, and my tumor was 80% related to Keytruda, so that was a very good relationship. Prior to that time, I had had a gamma knife for the metastasis. And that also has been very effective, and I had no side effects. I've had no side effects from the Keytruda.
So talk to us about the treatment that you're undergoing right now.
Well, I go down every 3 weeks to Hershey. I have labs, I meet with Dr. Hull, and then I get an infusion. And basically, after that, I just go about my life. I've had no side effects. I just feel very lucky. It's been wonderful.
And as you mentioned, did you say that it's been your 15th month now that you're starting this treatment?
Yes, yes. I started in September originally of 2019, and so now it's been 15 months. As I said, I've had no side effects. It's been no trouble at all.
And tell us, how are you feeling? You look great.
I feel wonderful. I feel really good, yeah. And I have throughout the treatment. I've never had any problems.
Okay, great. Joan, thank you so much for sharing your story with us.
You're very welcome.
And if you would like to make an appointment with the Penn State Cancer Institute, call 866-259-3713 or visit online at cancer.psu.edu. Now joining us is Dr. Raymond Hull, Director of the Penn State Cancer Institute, and also Joan's doctor. Joan is 15 months into treatment now, and she told us that she did not want chemotherapy. Let's talk about treatment options.
Sure. So Joan is not unusual. What I'd say is she was, when I first saw her, 85 years young as compared to old. But she was really set against chemotherapy because of what she saw in other people who'd gotten it. We actually do a really good job with chemotherapy these days. But, for someone her age, there are other options. Because of the nature of her cancer, and it had gone to the point where surgery was not an option for her, we ended up going with this immune therapy that she described. And what this does is it really allows her own immune system to recognize the lung cancer and to attack it. And she described a little bit of how we do it, but it's really been a godsend in terms of the treatments. And she receives this infusion every 3 weeks. And as she described, and when I see her every 3 weeks, she has really very, very little, if any, side effects. So much so that every once in a while I've got to make sure we've really been giving her the right treatments.
Yeah, it's really amazing how well she's doing and what a difference this type of medication is making. Now, she did mention that she continued her treatment during the pandemic and she really never skipped a beat. Why is it so important that patients continue treatment right now?
Yeah, so treating cancers with chemotherapies or immune therapies such as Joan's getting are really, really important to stay on schedule. The way to think about it is that the treatments we give, they knock down the cancer cells, and side effects certainly people have, knock down the rest of the body, but then we get, the rest of the body gets better, but the cancer left on its own devices will get better as well. And so the goal of all of our treatments is to really continually chip away at the cancer more than the rest of the body, the rest of the person. And so she was really a trooper. And we were fortunate in that we kept most of our patients who were undergoing chemotherapy or immune therapy on schedule during the worst of the pandemic in the spring and early summer. And we're still able, even today, to be able to do that. So it has everything to do with having the drugs continuing to have their benefit. In her case, it has everything to do with the blood levels of the drug being high enough so that it allows her immune system to continually go after her cancer.
And you mentioned it briefly, but let's talk about the safety measures that you do have in place.
Yeah, so we have really extraordinary safety measures, and and I'm really proud as the director to say we've done an outstanding job. I'm at home right now, so I'm not wearing a mask. But were I in the clinic, I'd be wearing a mask. I'd have glass shields for myself. Patients that come in and they're screened with screening questions, their temperatures taken, they're wearing masks. We have all of our staff have been very, very fastidious about if they screen, they're screened as well. And if anybody feels sick, they stay home. And we really work very, very hard to keep people safe and we've been managing to treat through, as we described, the pandemic. And many areas in the medical center slowed down during the pandemic, at least in March and April and over the early summer. We were one of the few areas where our infusion area, where patients received IV chemotherapy and immune therapy, we just continued. And we really had the same volume as we had before.
Okay, great. Dr. Hull, very comforting news. Thank you so much for all that information tonight. And if you would like to make an appointment with the Penn State Cancer Institute, call 866-259-3713 or visit online at cancer.psu.edu. Once again, that number is 866-259-3713. Now joining us is Dr. Brian Hirsch, a pulmonologist at Penn State Health. Thanks for being with us.
Yeah.
Let's talk about lung nodules. What are the signs and symptoms of lung nodules?
So most lung nodules are completely asymptomatic. They're typically found when a patient undergoes a CT scan for another reason. For example, they get a CT scan for bronchitis, or if they have some abdominal pain and they get a CT scan, which shows the bottom of their lungs, and a nodule might be detected. Historically, it's been very difficult to detect lung cancer, especially lung cancer in the early stages. The guidelines for lung cancer screening have really only been around for a few years, since about 2013. And some of the pulmonary international societies are working on updating the guidelines with a goal of better and earlier detection of lung cancer. So most of the signs of lung cancer are very vague and often go unnoticed, which include, as you heard earlier, cough, one that's changing, coughing up blood, chest pain, shortness of breath that's changing and worsening, hoarseness of the voice, unintentional weight loss, and increased thirst. So it's really important to notify your healthcare provider of any of these symptoms.
That's good news to know. Penn State also has a new lung nodule clinic on the West Shore in Lemoyne. Talk to us about what do you actually do there?
Of course. So at our lung nodule clinic, we receive referrals to evaluate lung nodules that are found on a variety of CT scans. And then we're going to carefully look at these scans and compare them with any prior scans that the patient may have had. And we're looking for areas that are changing or any concerning features of the nodule that may indicate an increased risk of cancer. So then we're going to review with the patient all of these things, and we're going to provide reassurance that we're going to keep a close eye on any areas of concern. So for example, there are some patients that we need to follow with a new scan in 3 to 6 months, others may be in a year, and others may not need follow-up. We will openly discuss all of these findings with our patients to help them make informed decisions regarding their treatment. An added benefit is a weekly interdisciplinary conference that we have that evaluates difficult cases with thoracic surgery and the radiology department. And with this collaboration, we are better able to determine the best therapeutic options and treatment plans for our patients.
And what happens if the nodules do appear to be cancerous?
So when we become concerned about a nodule, we have a few different strategies that we may need to use. There are additional diagnostic tests that will allow your doctor to confirm the diagnosis. These tests will include such things like a special CT scan, like a PET scan, a bronchoscopy where we're actually visually inspecting the airways, or a bronchoscopy or sampling of the nodule. And the biopsy is really done when the findings of the prior tests are concerning. So when we take all of these tests together, this will allow you and your doctor to make the best treatment plan. And this often requires collaboration with other medical teams to provide the best care.
Okay, lots of really good information. Dr. Hirsch, thank you for joining us tonight. And if you would like to make an appointment with the Penn State Cancer Institute, call 866-259-3713 or visit online at cancer.psu.edu. Denise, we understand a lot of cancer patients at Penn State Cancer Institute have concerns about this pandemic. This comes on the heels of some new restrictions for Pennsylvanians. Can you help answer some of those concerns?
Absolutely. Joining us is Dr. Kevin Reksowski, oncologist at Penn State Cancer Institute. Thank you for joining us this evening. We talked a little bit earlier about safety precautions being taken at Penn State Cancer Institute, but what can cancer patients do to protect themselves right now in our communities?
Yeah, so right now in our community, we're seeing widespread of COVID-19. We're seeing cases everywhere in all corners of Pennsylvania, especially in places where there weren't that many cases in the spring. So cancer patients should not let their guard down. It's really important that they're following strict masking and social distancing guidelines. We're hearing a lot about COVID fatigue, and that's really when people let their guard down, even for a specific encounter, such as a small gathering, and somebody could be asymptomatic and spread it to everybody at that gathering. So COVID fatigue is real. We all get it, but we really cannot let our guard down right now. We have to be masking, social distancing, and washing our hands more so than ever.
So let's specifically talk about how important it is for everyone to wear a mask so that we can help protect our most vulnerable patients. How does wearing a mask help to slow down the spread of the virus?
So our knowledge about masking has really evolved throughout this pandemic. So our initial thought was that my mask protects you and your mask protects me. We also now know that masks protect ourselves, so my mask protects me. So masks work because they block the release of respiratory particles that could be released into the environment as you're talking or singing or coughing. And these respiratory particles contain viruses such as the novel coronavirus. And then the mask protecting myself works because that works through filtration. So any particles could actually be caught within the mask and not be inhaled.
As we all know, the holidays are upon us, and we have heard recommendations that people should not be attending large gatherings to celebrate. What's your advice to cancer patients in this situation?
Yeah, the holidays are a real challenge for us because we all want to be with our families and our friends and our loved ones, especially for cancer patients because they are more vulnerable. And I personally just canceled my own holiday plan, so this is really challenging. So for cancer patients, I'm really telling them they really should be limiting their gatherings to household members only, the people that they live with. If you will be gathering with others, perhaps just a select few, ask them to quarantine beforehand, strictly quarantine beforehand. Maybe they could be tested beforehand as well, but they really need to quarantine after the test, because if the test comes back negative, you could still become infectious between the time of the test and a gathering. And get creative with plans. You could do a virtual pie or cookie decorating contest, or perhaps a video chat with friends having a cocktail. But if spread continues through Thanksgiving, I think Christmas and New Year's could be even more challenging for us.
Thank you.
This is really hard to hear, but a life saved is worth it.
Thank you for those tips. We do have one more quick question for you. Now, we've heard reports that a vaccine is on the way. What could this mean for cancer patients?
The vaccine is promising. It looks like it has about 95% efficacy in preventing COVID-19 infections. It also prevents severity of infections. So we're still awaiting the safe data, which should be released in the next few weeks. For cancer patients, I think it's important to realize that they may be in the vulnerable population who would be eligible to receive this vaccine early, as soon as it's released. So we're thinking that the vaccine will be targeted.
Thank you again very much. Again, wonderful tips tonight. We do have to cut it short. Thank you. And Deborah, back to you.
Thanks, Denise. Thank you for watching. We wish you good health.
ABC 27 is your local news source in Lancaster.
With kids spending more time at home, keeping them physically active can be a challenge. Find out how some curriculum changes are keeping them moving during the pandemic. That's Thursday on ABC 27 News Daybreak.
When you have zero worries and zero stress, there are zero reasons not to get into a Volkswagen. Click, call, or come by today. Visit our Volkswagen Sign Then Drive event and lease the 2020 Jetta S today with zero down, zero deposit, zero